Katie, can you tell me a little bit what your day's like? What's your shift? What do you do? What's your day? What's your care level that you provide people?
Yeah, sure. So I work the night shift. So what my shift looks like is come into work and get ready to work 12 hours. Another area that I specialize in is I'm an ECMO specialist. So that's either a
What was
trained
that word?
ECMO.
ECMO.
It stands for extracorporeal membrane oxygenation, but to simplify it, it's basically when the lungs are so damaged and unable to work, a machine takes over that function. It's a complex machine, and it takes some special training to be able to take care of patients on this therapy. Because of the specialty with this therapy, if I'm the ECMO operator that night, I will plan on being in a COVID positive patient room for the majority of my 12-hour shifts. We have to wear, no jewelry, just our basic scrubs. And thank you to the community for sending us a bunch of free socks. That's not a fashion statement. We wear our long socks to make sure our scrubs don't drag on the floor, and drag COVID around. And then I have to gear up in all my PPE. And we are so cognizant of doing this correctly. There's actually a trained observer that watches me put on my PPE properly. And then I'll get ready to sit in that COVID room for 12 hours. And because we want to really limit exposure to other staff, we do take on a lot of those extra duties, such as some cleaning, taking out the trash. We try to limit when our radiology techs go in. So a lot of the times with these patients, literally push the bed up to the window to get the x-ray. We'll take on that role of physical therapy, occupational therapy. When we turn patients, these patients need to be turned to not get pressure sores. Typically, for some patients, you'd have more than 2 people, but we're doing even some of that extra heavy lifting. We do have plans in place to make sure, I get my break, but a lot of the time, we take our breaks, but to leave the room, it's quite a process too. We have to clean the door simultaneously with a trained observer. And then as I exit the room, it's about a 5-10 minute process of making sure I've wiped down the equipment properly that I've been wearing or dispose of it correctly. And that gives me time outside of the room just to eat, drink, and go to the bathroom, and then go back in the room. Other staff members, we have 2 different types of PPE masks we wear. There's an air purified mask, which is kind of like a hood. And then there's the N95s, and sometimes staff will wear their N95s so long because we have to. And then noses are red. We will have breakdown on our noses. It's really exhausting, but it's important work. And even outside of the room, we are adhering to those social distancing and universal masking. So when I leave, I'll put on a simple mask, and we are social distancing in the nurses station, as well as any work meetings. We're doing it via Zoom because those principles are so important.